Hi everyone, my name is Lorena Ibarra, and the bacteria that I'm going to be talking about today is Pseudomonas aeruginosa. Okay, so this bacteria was first discovered in 1882 by Carl Gezzard from wound infections in soldiers whose bandages had a blue and green color. And this bacteria is known for being an opportunistic pathogen. And this is primarily because it targets individuals who have a suppressed immune system. Okay, so for its reservoir, it's highly adaptable and it is known for being a plant pathogen that may infect plants such as lettuce and tomatoes, and it may also be found in freshwater environments such as streams, lakes, rivers, sinks, showers, and distilled water, and these are just some examples of where it may be found. So morphology and features. So this bacteria is a gram-negative rod-shaped bacterium, and it is very motile. So this is because of its flagella that it has that allows it to move, and it usually measures from 0.5 to 0.8 micrometers by 1.5 to 3 micrometers. And it is resistant to high concentrations of salts and dyes, and its optimum temperature is 37 degrees Celsius, and it may grow in temperatures as high as 42 degrees Celsius. Okay, so virulence factors and mechanisms of infection. So the bacteria has several virulences that cause pathogenicity, causing for the bacteria to be almost impossible to kill. Some of these include endotoxins. And endotoxins, when the bacteria dies, all the pieces of the bacteria will degrade and come apart, releasing toxins to the host. An example of this is the presence of endotoxins inducing a fever, and once the bacteria grows and dies, it will release that endotoxin. Another factor is type 4 pili. And these are long hair-like filaments on the surface of bacteria, and it allows for bacteria to attach to host cells, as well as this bacteria has a flagella that helps the bacteria move. Another factor is that it can form biofilm, and this protects the pathogen from the host cell's immune system. The biofilm can also cause inflammation at the site of infection. And this bacteria has an outer membrane that helps protect it from antibiotics as well, and it has a multi-drug efflux pump that can help pump antibiotics out of the bacteria into its surrounding environment. This bacterium can cause infections in a variety of ways, ranging from bloodstream infections to chronic lung infections and infections of severe burns, targeting those who are immunocompromised. Some examples include urinary tract infections, respiratory infections, dermatitis, soft tissue infections, gastrointestinal infections, and these are just some of the few that can occur if an individual were to get this bacteria. Signs and symptoms. So symptoms of infection depend on the site of infection. However, some signs of infection can include fever, chills, body aches, lightheadedness, vomiting, difficulty breathing, coughing, or painful urination. So for transmission, those who are most at risk are hospital patients who are on ventilators, catheters, and those that have some form of surgery wound or a burn. These bacteria can be spread in healthcare settings by exposure to contaminated water or soil, and they can be passed from person to person by touching contaminated surfaces. When it comes to Pseudomonas aeruginosa, there has been a rise in antibiotic resistance. The best way to treat a patient is by administering antibiotics. Oftentimes, a doctor will administrate 2 different types of antibiotics simultaneously. Before treatment is started, a sample of the specimen is collected and sent to the lab. This is to ensure that the correct antibiotic is selected in regards to antibiotic resistance. Prevention. So when it comes to prevention, the spread of this bacteria can be prevented by healthcare workers, patients, and individuals constantly washing their hands with soap and water or by using alcohol-based hand sanitizer. It's important for healthcare providers to remember to practice good hygiene and to wash their hands before touching a patient or handling any medical device. Although this is a practice that has been commonly used before, we are now seeing this preventative measure be publicized more and more often, especially now during the COVID-19 pandemic. Immunity. There is no vaccine against Pseudomonas aeruginosa. If an individual were to contract this bacteria, they would produce a naturally acquired active immunity. This is because immunity is built by a person's own immune system after exposure to the infectious agent. Some interesting points that I'd like to talk to you about include that most of the patients that are infected are those who are immunocompromised. It is the #1 cause of intensive care unit pneumonia, and it accounts for 10% of all infections contracted in hospitals. It is also one of the most common forms of burn wound infections. So these are some of the multiple choice questions. #1, what makes this bacteria resistant to antibiotics? And the correct answer to that is B, it's virulence factors. #2, what is this bacteria known for? And the answer is A, being antibiotic resistant. #3, who is more susceptible to contracting this pathogen? And the correct answer is B, a middle-aged woman battling cancer. #4, which of the following is not a sign of infection? And the correct answer is A, sneezing. And #5, this bacteria is gram-positive. This is just a true or false question. And the correct answer is B, false. It is gram-negative. Okay, and here are a list of some of the websites that I went ahead and looked at and reviewed in order to create this PowerPoint. Thank you guys.